Masters of Public Health is a very important course in the health arena because it looks at the overall picture of the health status of the community or populations.
It's the future of everything because it's concerned with tracking development of diseases and coming up with some researchers to find out exactly where a given condition has originated using some of these basic tools like epidemiology and research.
Yeah, the minimum requirement for studying MPH here are that you should have a first degree in health-related subjects. You can be a nurse, you can be a pharmacist, you can be anybody who is health-related, who have the basics of health, that they can be able to enroll in the MPH program.
A nurse based in Francistown. Currently, I decided to study Masters of Public Health.
The students that we are producing here, we want them to be able to be well-versed with health events and their exposures. They should be there in the community to be able to identify health events. If they are told there's an outbreak, they should be able to do disease surveillance to go and see what are the possible causes.
It helps the lawmakers take decisive decisions when it comes to allocating of resources to combat diseases, because of the studies that were carried out, because of some academics and some institutions which assisted using this pillar of public health.
So if you really want to study Masters in Public Health, come to GUC. GUC has a well-structured Masters program, and learning is made easier by the module system where we constantly interact, both lecturers and students, and therefore you are always able to consult your lecturers where you have problems. Lecturers are always able to communicate and be in touch with you to assist wherever you have challenges.
It's convenient to study in GUC while you are still working at the same time, because as far as I'm concerned, it's the only institution in the country that provide part-time masters in public health. And the quality that they produce has convinced me that I can acquire my masters in this institution.
The conglomerate of health personnel, like public health officers that are trained specifically for public health, they are epidemiologists, they are nurses, they are doctors, there's even at the lowest level, healthcare assistants and lab scientists. All aspects of the health arena should be represented in teams that work in public health, because they cannot do anything in isolation. There are linkages depending on what the problem is that exists. You should be able to know who is most relevant for this particular challenge. Identify any health problems that exist within the communities and be part of the research and control structures within the community.
My intention is to acquire as much knowledge as I can in GUC for this coming 2 years, so that I can have an input in the further development of our healthcare system in general. This is what I'm looking for.
The tuitions are much reasonable, looking at the amount that we are paying versus the quality of educational training that we are getting here.
I would like to encourage people who are willing to study this program to come in numbers, because currently there are few specialists in this area, of which we have seen during the COVID-19 that we need a lot of people who can deliver in this field. I have a lot of friends who acquired their certificate, diploma, degree and masters in JUC, and they are successful, which shows that JUC is well recognized around the country and abroad.